Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon. I specialize in facial rejuvenation. And today we're going to talk about a topic that a lot of you have asked me about and that I've alluded to and discussed in brief, and we're going to devote a little bit more time to it, and that is microneedling. Microneedling with radiofrequency, with PRP, or by itself. And I'm going to break it down for you and help you understand the values, the pros and cons, the pitfalls, things you should be aware of, and ultimately a user's guide to microneedling as a whole in your quest to achieving youthful and beautiful skin. In order to do that, I'm going to set up by talking to you principally about how skin ages, what are the basics to good skin routine and good skin hygiene, and then finally we're going to break down microneedling into its basic pieces and put into a very understandable way for you to know where microneedling fits in and why in general it's a very nice treatment, but what are the cautions and care that you need to go into making decisions about what particular type of microneedling and which ones are right for you. So let's break it down. As far as how skin ages, the most important thing you need to understand here is that skin aging is happening at a multi-level sort of a way. And what I mean by that is there's multiple things happening at the same time. In order for you to engineer the right treatment regimen, you need to know what those changes are. And let me just simply break it down. As skin matures, there's some biological things that are happening that end up making the skin look older. And what are those changes? Well, number one, the skin's water balance and moisture balance becomes tipped towards dryness and dehydration. Number two, fine lines and wrinkles begin to set in. Number three, there's increase in the production of melanin, so you get discoloration. There's broken capillaries leading to red discoloration. There's loss of collagen. As you're younger, it's pretty plateaued, high levels of collagen production, and then as you age, 30s, 40s, 50s, 60s, collagen production begins to diminish, which then also relates to thinning skin. Thinning skin leads to loss of elasticity and sagging. Pores increase. That's another change that occurs. And then there's an overall increase of dullness as a result of the increased thickness of the stratum corneum, which is the upper layer of the skin. So when you look at all this stuff together, you see skin that doesn't look as bright, doesn't look as luminous, is more lined and wrinkled, is crepey, and is discolored. All of which are analogous to and suggestive of aging skin. So once you understand that, you have to say, all right, in order to properly address these, I need to address all of these changes because I think the common knowledge, the common approach is people have a very targeted approach. They just do one or two of these things and they don't do the other ones. And a more common thing is that people oftentimes will utilize non-surgical treatments like lasers and microneedling, etc., without recognizing that it doesn't address all the aspects, and that's where some of the disconnect in terms of the improvements that people want to see. So let's break down what are the basics to how to address skin properly even before you start doing your first microneedling treatment. So number one, diet is very important. You need a diet that is high in vitamins and minerals, clean overall, less processed foods, etc. Cannot stress the importance of this. The skin is your body's largest organ. It reflects exactly what's happening on a health level. Number two, sleep is extremely important. When you decrease your sleep, your skin starts to dull, it loses blood supply, it just looks ashen and gray, and it just doesn't look quite glowy and healthy. Number three, hydration. What you hydrate your skin with and how much you hydrate is going to improve the plumpness and suppleness of the skin. Then it's how you protect your skin. Sun is an extremely important component because not only does it dehydrate skin, but it also accelerates the loss of collagen and the overall enhancement and increase in the pigmentation. So it's like 60–70% of all aging skin changes are accelerated by the exposure to UVA light, and that's where the use of a broad spectrum sunblock is extremely important. Then you get into what you do for your skin on a regular basis. The use of a comprehensive skincare routine that addresses every single one of the things that we just talked about. It enhances moisture, oil production, decreases fine lines and wrinkles, decreases pigment production, increases collagen production, and ultimately exfoliates and decreases that dullness to the skin, so you get luminosity and brightness back. That typically involves a comprehensive and multi-product approach. Just to give you reference, the reason why I developed the Karam MD trifecta was specifically to make using such a comprehensive approach simple, and you can learn more about that on our website. The next step is where you start getting into the game of how can I take my skin to the next level, and that's where microneedling fits in. Microneedling, lasers, any type of procedure like that, the fundamental change that you're trying to affect that's going to help you win over the long run is increasing collagen stimulation. And let me just break it down for a second, just so we kind of put this into context. As I said, on a cellular level, your fibroblasts, which are the cells that make collagen, begin getting lazy. They stop making as much collagen. And so as a result, the thin of the skin, loss of elasticity, all those kind of things that we just talked about. So now we have to think of a way to bypass biology, evolution, genetics, all that stuff. And in order to do that, there's one simple thing, and that's injury. Injury causes your skin to bump up the production of collagen because it's trying to heal itself. When you cut yourself, it heals with a scar. Anytime you create injury, the response by the tissues is collagen, which is basically scar. So what you're doing effectively with microneedling is you're using hundreds of thousands of little pokes of a needle to try to stimulate the collagen, because the tissue is saying, ooh, I got poked, I've got injury, I need to heal, so therefore it initiates and turns on the fibroblasts to make more collagen. So slowly but surely over time, you're building collagen back up. And if you do this on a regular basis, every 3 months, 4 months, you're going to continue to see waves of collagen building upon itself and building momentum. So instead of going down this way, you're going to start to go this way. And if you're already up here, you're going to maintain levels of collagen, so you actually won't dip. That's why I always say preventing your skin from aging is much easier and more fruitful than trying to build it up from the ground up. But even in that case, it will definitely still have merit and still have value. So where does PRP and radiofrequency fit in? PRP is where we draw blood from the veins, you spin it down, you get the component of the blood that is rich in growth factors, platelet-derived growth factors, all the things that are known to stimulate tissue to build. So after making a ton of little holes into the skin, you take that PRP and you lay it across the wounded area, and as a result, it absorbs a little bit, and on a cellular level, the idea is that it stimulates the cells to create even more collagen. So you're getting a more robust and enhanced result. Now, very popular approach, generally speaking, very safe. You just have to make sure sterile technique and all those things are taken care of. Every one of these things that you do increases the price tag of the microneedling event. So regular microneedling, very commonly found in a lot of different places, relatively inexpensive. Add PRP, you increase the price just a little bit. Now you're going to the next level, bringing in a little bit more technology. So you're gonna do the same needling effect, but at the tips of the needle, you're gonna release heat. And the heat through radiofrequency creates a bipolar or monopolar event, which is like cautery, essentially. And that heat creates a injury that's a little bit more deep and a little bit more profound, and as a result, stimulates, theoretically, again, more collagen. And heat in of itself creates a little bit of contracture. So the idea is that by disposing heat into the dermis of the tissues at the same time as creating the needles, what you're doing is you're getting not only a tissue response because of collagen, but you're also getting a little bit of a shrinkage result. So enhanced collagen production and actually shrinking of the skin, which is a very good thing in general. Caveat, this is where I want you to be very careful, and here are some of the pros and cons. Pros are enhanced collagen, shrinking of the skin, a little bit of a better result than you would get with standard microneedling. Cons, increased price naturally. So if you had to make a decision of doing 2 or 3 treatments of radiofrequency microneedling versus a year or 2 of regular microneedling, personally I would take regular microneedling because I think the consistency of that collagen stimulation is more important. Second con, this is where it gets a little shady, in my opinion. Certain devices and certain practitioners take that shrinking concept and try to apply it to the deeper tissues, the fascia, and try to call it some type of replacement for a facelift, and try to talk about it as something that's going to treat looseness and sagging and fundamentally be an alternative, a non-surgical alternative to a facelift. This is where it completely fails and it gets dangerous, because in order to do that, those needles will have to penetrate deeper. And once you go deeper and you start putting energy into a deeper tissue layer, well, guess what's just one layer below the skin? The subcutaneous fat. So the subcutaneous fat, which is that thing that gives the skin that suppleness and that softness, both in the neck and in the face, energy deposition in that deeper layer, theoretically, can cause the fat to melt like butter. People who've had microneedling with radiofrequency in that deep way, and I'm not going to name particular categories, just know deep, and when I would talk about what deep means, have many times had complaints that their face actually looks older and more lax as a result of that. And here's the reason why the concept is flawed, in my opinion. Going that deep, you have to get down to the fascia. And normally what's below the fascia are the facial nerves. So even if you go deep enough to get to the fascia, well, you're risking putting energy next to a facial nerve, which could cause paralysis, inability to smile, or wink your eye, or close your eye, or any of these kind of changes. So to me, the whole concept is fruitless. If you're gonna do radiofrequency microneedling, which we do in our practice, we keep the microneedling to a safe depth range, usually 0.5 to 1 millimeter is kind of the maximum that we go. And typically in the neck, it's gonna be around that level because the neck skin is a little bit more thin. And on the face, depending on the parts of the face, you could go up to potentially 1.5 and even 2, depending on the areas of the face that you're treating. But that is sort of the maximum range that you want to treat with radiofrequency microneedling, in my opinion, because you don't want to melt deep fat and you don't want to nail facial nerves. And ultimately, why take the risk when there's no chance that you're going to actually be able to lift the face and create a truly comparable result surgically? It just doesn't make any sense. So think about microneedling, whether it's regular, whether it's with PRP, or whether it's with radiofrequency. Think of it as a skin deep treatment, something to improve the quality of the skin, which I'm a huge, huge proponent of and a major fan of. And I think it's a very good use of technology and use of financial resources and time to do something that's actually very good. But don't forget, the most important things are the things that you do before you even enter the medical spa or derm practice or plastic surgery office, which is sun protection, diet, exercise, sleep, and very, very importantly, the use of skincare that you do regularly on a daily basis, which actually work at the cellular level to also build up collagen, decrease pigmentation, etc. And then you get a boost with these other treatments that you do in addition to it. So think of it as a continuum, and you want to start at the far left and then move your way up to the right. And I will definitely give another video on different lasers and how they fit into the overall anti-aging skin regimens, but know that this is the most important combination of things that you need to know about when you're making a decision about microneedling and the variations that come along with it. Guys, I hope this helped. I hope this brought some light and clarity to the subject of microneedling, which is a very popular and common procedure that's done, and rightfully so. It's a good treatment overall. Just use it safely, use it appropriately for the right indications. I hope you enjoyed this content. If you did, make sure you hit like, make sure you pass it along to friends and family to get the word out. And if you love this type of content or want to learn more about this kind of stuff, follow along, hit subscribe, because I present 1 to 2 to 3 videos every single week on this topic and on my other social media channels as well. Any questions or comments you have, drop them in the comment section below. I will absolutely do my best to get to those. And for those of you who want to learn more about skin, there's going to be some videos following this, as well as you can jump on my website for Karam MD Skin and learn more about the different combinations that we have as part of our trifecta. All right, everyone. Thanks so much. Dr. Amir Karam. Until next time.